thank you very much to the Institute of Public Health and especially Adam and the technical team for the opportunity to present this work today, which is part of a larger study that we're doing at the Tobacco-Free Research Institute Ireland on disabilities, smoking and e-cigarette use. And I'm presenting today on behalf of my colleagues Salome Sunday, Michael Shevlin and Luke Clancy. We have no conflict of interest to declare. So in terms of the background to this larger study, teenagers with disabilities are at greater risk of future negative financial, mental and physical health impacts due to tobacco use and addiction. And despite all this, they are routinely excluded from data collection, either directly or indirectly. And so they're also excluded from the efforts of tobacco control leaders and from dedicated smoking cessation and prevention programs. There is a large body of literature on teenage smoking worldwide, with good reason. It's the age that most people start smoking. And we at the Tobacco-Free Research Institute Ireland are the principal investigators for the European Schools Survey Project on alcohol and other drugs. We've been collecting data on teenage smoking and latterly e-cigarette use since 1995 in ESPAD, but we know almost nothing about the smoking habits of teenagers with intellectual disabilities. There is a small number of studies worldwide about smoking in this population, but the studies are small. The findings are mixed. Some of them find that prevalence is a bit higher, a bit lower, and in some it's similar. E-cigarette use, as everybody knows, has grown very much in the last 8 or 10 years in Ireland, but we know almost nothing of e-cigarette use in teenagers with intellectual disability, though we do know quite a lot now about the prevalence in teenagers generally and the associations between e-cigarette use and smoking. And we also know very little about gender and social class differences in the population with intellectual disabilities. So we had two main study objectives in this part of the broader study on teenagers with disabilities. And the first was to compare prevalence of smoking and e-cigarette use in older teenagers with and without intellectual disabilities. And then we wanted to focus more specifically on the population with intellectual disabilities to see whether there were gender and social class differences, which we find in the broader population, whether they were evident in this vulnerable group. To address our study objectives, we were very fortunate to gain access to the Growing Up in Ireland study. As many of you will know, the Growing Up in Ireland study has two cohorts, a child cohort and an infant cohort, now called Cohort 98 and Cohort 2008, because they surveyed the young people first in Cohort 98 when they were 9 years old in 2008, and the infant cohort when they were infants in 2008. Our interest is in Cohort 98, who are now in their mid-20s. There have been 5 waves of data from this group, starting in 2008, 4 full waves and a COVID wave. And for this, so they were surveyed at ages 10, 14, 17, 18, 20, and so on. These are the 17 to 18-year-olds surveyed in 2016. And we have a valid sample of 6,154 17-year-olds that we analysed for this study. I'll just say a little bit about the variables that we used in the study. There are many questionnaires for each of the waves of Growing Up in Ireland, and we drew on questions from the parent main questionnaire for the variables on intellectual disability, gender and social class, and on the young person supplementary questionnaire for the smoking and e-cigarette questions. To find the variable about intellectual disability, the parents were asked, does the young person have any of the following long-lasting conditions or difficulties? And one of those was intellectual disability. Gender is a binary variable in the survey, and the respondent sex is coded male or female. And social class was derived from the question, what is your occupation in your main job? And we recoded that into a dichotomous social class variable, professional, managerial, and others, which was about 2/2 of the population. The ever smoking question was on the young person supplementary questionnaire. They were asked, have you ever smoked a cigarette, yes or no? If they answered yes, they were asked which of the following best describes you, and those who said that they smoked occasionally or smoked daily were recorded as current smokers. And finally, they were asked, have you ever used an e-cigarette or vaping? And they answered yes or no to that. There's no current e-cigarette use question in this wave of growing up in Ireland, but there is in subsequent waves in wave 4 for the 20-year-olds. In terms of our analysis, we used wave 3 as a standalone data set, looking at, we took a cross-sectional approach rather than a longitudinal one. And then we used fairly straightforward statistical techniques, which I'm going to present now in 4 tables. And the first one is about the prevalence of intellectual disability and the prevalence of smoking and e-cigarette use. So on the top line here, you will see, that the prevalence is 2.3% in the population, this nationally representative sample. The column total here shows the prevalence of ever smoking, current smoking, and ever e-cigarette use. So you see about half of all 17-year-olds said that they had ever smoked. About 20%, 1 in 5, said that they were current smokers, and over a third said that they had ever used e-cigarettes. We looked then at those with and without intellectual disabilities, and the first thing we can see is that those with an intellectual disability are significantly less likely to have ever smoked than those without intellectual disability. So 36% compared with about a half of those without an intellectual disability. Sorry about that jumping around, and that was statistically significant. However, in terms of current smoking and current smoking, there is very little difference between those with and without intellectual disability. About 1 in 5 of those with an intellectual disability are current smokers, despite being significantly less likely to have ever tried smoking. And then they're less likely to be ever e-cigarette users, but not significantly so. So there's some comparability there. Then the next 3 tables are about the population with intellectual disability in wave 3 of growing up in Ireland. So we looked at the spread of intellectual disability by social class and gender, and you'd see that there aren't any significant differences, though they're slightly less likely to be in families that are professional, managerial, social class, and slightly more likely to be male. But as I say, there aren't any significant social class or gender differences in the prevalence of intellectual disability. This table looks at gender differences in smoking in the 17-year-olds who have an intellectual disability. And you will see here that girls are particularly at risk of smoking. So 44.7% compared with 27.9% of boys had ever smoked. And that wasn't quite at the level of statistical significance. I am sorry, the screen is running all over the place. But this current smoking shows that girls are more than twice as likely as boys to be current smokers. This is a very interesting finding for us, because what we have found in recent surveys of this age group in SPAD is that boys are significantly more likely to be current smokers and significantly more likely to be e-cigarette users than girls. So this particularly vulnerable group of young people with intellectual disabilities, girls are more at risk. And in terms of e-cigarette use, there weren't any gender differences. And finally, this is in terms of social class differences. You'll see from the right-hand column, there aren't any statistically significant differences, though there is a pattern for young people with intellectual disabilities from professional managerial backgrounds to be less likely to be ever smokers, current smokers, and ever e-cigarette use. And this is something that we have also found in our population studies of 16-year-olds in SPAD, that there is an emerging trend. The adult trends for social class and smoking are very clear. Social class, higher social class is protective against smoking. And there are emerging patterns for that in the 16-year-olds, suggesting that other factors might be at play. So in summary, teenagers with intellectual disability do smoke and use e-cigarettes. Their prevalence of ever use is lower than that in their peers without intellectual disability, but the prevalence of current smoking and of ever e-cigarette use are similar. They're less likely to try smoking. More of them become current smokers. This may indicate an increased risk of addiction to nicotine and lower likelihood of cessation. And as you saw, girls with intellectual disability are particularly at risk. As with smokers in the general population, smokers with intellectual disabilities will get sick from tobacco-related diseases and are deserving of appropriate tobacco dependence treatments. There are no dedicated services for this population, which likely increases inequality even more in this group. And we recommend the development of best practice interventions for prevention, treatment, recovery, and smoking cessation for this vulnerable group. And when these targeted programs are being developed for people with intellectual disability, in light of these findings, we recommend that gender sensibility is also included. These are some of the references that we mentioned. They're available in the slides. And we would like to thank the RCDHT for funding for this broader study on disabilities, inequality, smoking and e-cigarette use, which we are carrying out at the Tobacco-Free Research Institute, Ireland. We will be presenting findings on other disabilities and connections with smoking and e-cigarette use. And finally, thank you to the Central Statistics Office for all of their support approving and supporting our access to the researcher microdata files. And thank everybody here for attending and listening.